In the previous lecture, we talked about the determination of the normal cardiac vector or cardiac axis. In this lecture, we will talk about the understanding and determination of the abnormal cardiac vector, which is also called the cardiac axis, deviation of the cardiac axis. So there are 5 methods of determination of the cardiac vector. We will go one by one. The first method, which is called the two-thumb method, takes into account lead 1 and AVF. I have drawn the diagram before. So this actually states that if the QRS complexes are upward in lead 1 as well as in AVF, the vector is normal. It is lying in the normal orientation. Now, if the vector, the QRS complex is down in lead 1 and it is up in AVF, this means that the vector has shifted away from the lead 1 towards the right side, because this is AVF and this is lead 1. So if the deflection is down in lead 1 and it is upward in AVF, this indicates that the patient has got right axis deviation, right? If we talk about the axis, the QRS complex is down in AVF and it is upward in lead 1, this means that the vector has moved away from the lead AVF to the left side. So this indicates basically the left axis deviation. And the third way, if we talk about that, if the complexes and the QRS complexes both are down in AVF and lead 1, this means the vector has moved away from this as well as from this in the other direction, in this direction, which is the extreme right axis deviation. So in both upward this is normal. If it is down in 1 and upward, this is right axis deviation, right? If it is up and it is down here, this is left axis deviation. And if it is down in both, this is extreme right axis deviation, extreme right axis deviation. This is very simple and it can be applied by using the thumbs. The second method, which is also related to the vector AVF and lead 1, is first we have to determine the QRS complexes in 1 and AVF. For example, here and AVF, the QRS complexes from the ECG. For example, suppose the Q, and these are 1, 2 big square, right? 2.5 big square and half big square is downward, 2.5 upward and half downward. And here the upward and downward deflection, for example the upward deflection is 1.5 and it is 1 big square, right? Now we will take the net. This is 2 big square and this is 1 big square. Now just imagine that you have taken a calibration and you just plot these lower big squares on the relevant leads. This is 2 and is in upward direction, so it needs to be plotted on the positive pole. 1 and 2, from the 0, 1 and 2, and it is also upward but it is 1, so it lies here. Now you have to draw a vertical line from lead 1 and AVF on each other. The point where they intersect needs to be calculated from the 0. If the vector is drawn from the 0 to the point where they intersect each other, is actually the correct vector. Now in another way, for example, it is, suppose, downward, this is 2.5 at the 2 big square is downward, and it is suppose upward in area of 1 big square, right? So now we have to calculate the vector. So in lead 1 we have to draw it on the negative pole, so 1 and 2, and here it is 1 big square, so it needs to be plotted on the positive pole of the AVF. For example, it's here, right? Now we will draw a line from here down to here to see the point where they both intersect each other, and this line will be joined from the 0 point. So the vector is lying on the right side. This is right axis deviation and this is the normal vector. Now we can plot each, for example, upward or downward. This is very simple. The third method, which is important, is in the third method is again very simple. We just take a lead from the ECG which has QRS complexes of equal upward and downward deflection. For example, if I take the AVL, for example, this AVL has an upward deflection and downward deflection which is almost of equal calibration. 1 big square, 1 big square. Now this is basically AVL, the AVL, right? Now I have to look a lead which is at 90 angle to the AVL. To the 90 angle, the AVL, the lead which is at the 90 angle to the AVL is lead 2. Now I have to look for the deflection in lead 2. For example, if the deflection is upward in lead 2, this means that the patient cardiac vector is at lead 2. It is parallel to the positive pole of the lead 2. For example, if I take for example lead 1, the lead 1 has an upward and downward deflection which are equal, 1 big square or 2 big squares, which is equal. Now I have to look a lead which is at 90 angle to the lead 1. So a lead which is at 90 angle to the lead 1 is AVF. Now for example, if the deflection in the AVF is suppose downward, right? It is downward. This is the downward deflection, right? So this is the lead 1 which has an equal calibration, and the lead which is at 90 angle to the lead 1 is AVF, and it has a negative deflection. So I need to plot the vector in this direction, right? So the vector lies to the right side and even to the right axis, to the extreme right. Again, if I take another vector, for example, if I take the AVF has an equal upward and downward deflection. So the angle which is the lead which is at a 90 angle to the AVF is lead 1. Now if the lead 1, if it has an upward deflection, this means the cardiac vector is here. It's very simple. It can be calculated even for the AVR as well. Now the fourth method uses lead 1. The fourth method uses lead 1. This is lead 1, positive pole, negative pole, and this is AVF, right? We have to look for the QRS complexes upward and downward deflection in lead 1. If the R wave and the S wave are of equal magnitude in lead 1, this means that the cardiac vector is lying at 90 angle to lead 1, which is AVF. This is an angle of 90 degree. Now, if the R wave is smaller than the S wave in lead 1, this R wave is smaller than the S wave in lead 1, this means this vector has moved away from the 90 angle as compared to the lead 1. So the 90 angle is here AVF, which is the normal range of the cardiac vector. It has moved even away from this. So the vector has gone to the right side. So this is right axis deviation. It's very simple. And the last method uses basically lead 2. The last method uses basically the lead 2. And it's very simple again. This is lead 1 and this is lead 2. Right? Lead 1 and lead 2. Now again, just like the method 4, we will take the QRS complexes in lead 2. For example, if the QRS complex is in lead 2, the upward and downward deflection, the R and the S wave are of similar amplitude, this means that the vector is lying at 90 angle away from the lead 2, right? And at 90 angle, the vector which is making a 90 angle to the lead 2 is AVL. So if the upward and downward deflection in lead 2 is similar, of similar amplitude, this means that the vector is at least lying at 90 angle away from lead 2. Now, if the R wave, if the R wave is larger than the S wave in lead 2, this means that this vector has moved even away more than 90 angle from the lead 2. If the S wave is smaller as compared to the R wave in lead 2, this means the vector has moved away and even beyond the AVL limit. The AVL is lying at minus 30 degree. If we remember from the previous vector, from the previous discussion, so the vector has moved away from this, which is the left axis deviation. So these are very simple method of determination of the cardiac vector. So I think it will be very helpful in determination of the cardiac vector when applying this on the real ECGs. Thank you very much.